Hi, my name is Cindy Tatiana Jimenez Alvarez. My topic about is free and report JAK Inhibitor Therapy in a child with Inherited USP18 Deficiency. Definition. Definition: deficiency ubiquitin species PDS 18 USP18 is a severe type 1 intervermopathy USP18 than regular type 1 interface signalis by blocking the access of Janus association y kinases 1 JAK1 to the TAI1 interferon receptor.
Mechanism of action of JAK inhibitors. The Janus kinase, or JAK protein family, consists of JAK1, JAK2, JAK3, and tyrosine kinase 2, or TYK2. They interact with the intracellular portion of cytokine receptors and play an important role in the signal transduction pathways for multiple cytokines, including pro-inflammatory cytokines such as interleukin-2 or IL-2, IL-4, IL-7, IL-9, IL-13, IL-15, IL-17, IL-21, and IL-23, which are involved in the pathogenesis of IBD. JAK1 and JAK3 modulate an adaptive immune response via IL-2, IL-4, IL-7, IL-9, IL-15, and IL-21 signaling. JAK proteins are associated with distinct cytokine receptors, but initiate their transcription response via common intracellular signaling pathways. Physiologically, a cytokine binding to its specific cell surface receptor initiates a conformational change in the receptor that in turn leads to recruitment and
application in nursing, where assess the infant symptom in the prevent radial resulting in waning from ventilator support. The evaluator of the test already performed choose a computer thermography or magnetic resonance imaging of the heart performed of the sure placent revelar and result of the hydrocephalus hemorrhages and isomia. The author of USP18 result in unitegram interfemoral inflammation and is later during the perinatal period. Pros and cons. Pros. The deficiency was characterized by perinatal onset, intracranial hemorrhage, calcification, brain malformation, liver dysfunction, sepsis shows like presentation and thrombocytopenia. Cons. Exon sequence will identify an homozygous mutation and on essential spleen C USP18 in the encoded protein was explained good Laker negative regular capacity.
So JAK inhibitors are a class of agents. They're oral agents. There's probably at least a dozen that have been in clinical development. And what they do is they potently inhibit a signaling pathway that's overactive in patients with myelofibrosis that contributes to the inflammatory cytokine milieu that mediates a lot of the symptom burden that we've been discussing, whether it's bone pains or inflammatory symptoms like fevers and night sweats. So much of the symptom burden that is part and parcel of having myelofibrosis is driven in large part by JAK-STAT signaling. And these small molecule inhibitors abrogate that signaling and reduce in a very potent way the inflammation that is mediating those symptoms.
JAK2 inhibitors are the only approved form of therapy for myelofibrosis. JAK-STAT signaling is a signaling system in the cell that is associated with proliferation of the cells, lack of interference with the death process of the normal cell, and production of a variety of cytokines. Not surprisingly, The JAK-STAT system
Insuciably in Ecuador. The case of a child who has an very complete deficiency of USP18 and survives well beyond the perinatal period to the sport card-ready genetic diagnostic be completed treatment with the JAK inhibitor resulting in reducing the number of patients requiring transfusion of their need on 26p9 more screen be 34% and 23%, demonstrating an increase in hematology level. Conclusion. Ruxolitinib treatment was followed by rapid and sustained recovery through JAK inhibitor made insoluble for the treatment of cancer and the treatment of disease or inflammatory or immuno-original. For the most significant absence has been made myelofibrosis, where they also better control of the hyperprophylactic manifestation as though they not seem to have the capacity to eradicate the disease. Thank you very much.